Our body has evolved an immediate and complex response to natural traumatic injury. First, platelets in the blood begin to form a clot. Immune cells then enter the wound to digest bacteria and debris. Large white cells, called macrophages, release a protein that leads to increased blood flow and tissue inflammation. Although pain, swelling, and redness accompany this process, it is necessary to contain the injury and prepare tissue for repair. Surgery, however, is very different from traumatic injury. Incisions created in a surgical environment are precise and virtually free of bacteria and debris. The robust inflammatory process so critical in traumatic injury may be in excess of that required for surgical repair. This can unnecessarily prolong pain, inflammation, and recovery after a surgical procedure. To mitigate excessive inflammation, doctors use non-thermal pulsed radiofrequency, or PRF therapy. PRF devices are non-invasive and applied postoperatively. PRF therapy works directly at the surgical site to reduce pain and discomfort by working with the body's natural tissue repair process to counteract excessive inflammation. During the natural healing process, injured tissues release cytokines that initiate the inflammatory response and regulate tissue repair. In response to injury, calcium ions bind with calmodulin to activate constitutive nitric oxide synthase, or CNOS, which produces nitric oxide. PRF therapy enhances natural calcium calmodulin binding, which results in more nitric oxide production that works broadly to subdue the inflammatory process and downregulate inflammatory cytokines. This serves to reduce the inflammatory response and accelerate surgical recovery. Nitric oxide is also associated with vasodilation, nucleotide synthesis, and growth factor production, key elements in the tissue repair process. Surgical recovery by counteracting the biological processes responsible for